Tuka, quick, quick, quick. The doctor came with his bag and his hat, and he rapped on the door with a rat-tat-tat.
I have 3 children, all born at the Royal Columbian. The youngest, Jamie, was a difficult birth, but during the delivery and in the days after, I felt like I was in caring, competent hands.
You know, I remember stories my great-grandfather used to tell me about traveling all the way from Barkerville to the Royal Columbian to get fixed up. At that time, it was the only hospital on the mainland.
I've worked at the Royal Columbian for 4 years now. You know, it's a challenge, but I enjoy my work even on the toughest days. Everyone is very caring and committed here.
A tradition of caring. It's part of a commitment to the best health care possible. From the people who've been part of the Royal Columbian Hospital throughout its rich 125-year history. We're proud of our historic beginnings as the first hospital on the mainland of British Columbia. Built for the miners, loggers, and laborers of a daring new colony, we've been a beacon of hope and comfort for many generations. We've grown from a small weatherboard building to a busy, full-service 600-bed regional hospital, housing a wide range of specialized services, from maternity to geriatric care. With our sister hospital, Eagle Ridge, located just 20 minutes away in Port Moody, we're a referral hospital for well over 500,000 people throughout the Fraser Valley, right out to Hope. Both institutions are owned and operated by the Fraser-Burrard Hospital Society. And together, the Royal Columbian and Eagle Ridge hospitals are leading the way to better health care for our growing metropolitan areas. Eagle Ridge Hospital was opened in Port Moody in 1984 in response to an expanding suburbia. The hospital will continue to grow to serve community needs. It shares resources with Royal Columbian to ensure optimum care at both institutions. Saturday night in the Fraser Valley. It can be our busiest night of the week. At the Royal Columbian, we're in the front lines, fighting for life.
Okay, group and cross for 6 units.
Here at our trauma center, highly skilled and specially trained men and women are dedicated to beating the odds in the battle against permanent injury or illness or tragic death. Every year, we handle more serious accident victims than any other hospital in the province. And we've played an important role in the evolution of emergency health services in BC. We're strategically located in New Westminster, long a crossroads for British Columbia. Accident and heart attack victims from Burnaby to Hope are rushed along major routes to the Royal Columbian. In fact, no one in British Columbia handles more heart attacks than the Royal Columbian. We've built the finest cardiology department in the province. Long ago, we established the first pacemaker clinic in Canada, and we're still the largest on the West Coast. Here at our neonatal nursery, one of the best in BC, we specialize in the care of premature and sick babies. In the obstetrics ward, high-risk maternity patients are closely watched, while in our prenatal assessment unit, we monitor the heartbeats of expectant mothers to increase the odds of successful treatment of complicated pregnancies. Pediatrics and orthopedic services continue to grow here as well, while neurosurgery benefits from the latest medical and technological advances in the treatment of strokes, seizures, and tumors. The Royal Columbian also serves as the primary diagnostic center in the area. We reach into the community with our mobile nuclear medicine service. Here in the Lower Mainland, medical technology makes house calls. But the community also comes to us when necessary, such as renal dialysis patients from all over the Fraser Valley. Many people face a long road back from injury or illness. At the Eagle Ridge Rehabilitation Unit, care teams provide medical, physical, and psychological aid throughout the recovery process. We believe our patients have the right to be informed about and to participate in their health care. Family and friends are also a part of that recovery process. For some patients, the Discharge Planning Unit eases the transition from hospital to home or to another institution. The programs are progressive, and so are the people. In our future, as people live longer, there will be a greater need for health professionals. And nowhere will the need be greater than in the field of nursing. The Royal Columbian has a reputation as a great teaching center. One of the areas we specialize in is the training of critical care nurses. Commitment and compassion are attitudes here at RCH, and teamwork is a way of life. We encourage innovation and cooperation among our specialized teams of doctors, nurses, physiotherapists, social workers, and other hospital staff. This is a place where people can be successful, grow, and be heard. There have been many changes since those early days when the Royal Columbian was a primitive small hospital. Since 1862, we've been open to the public, ready to help and to heal. We never close, and we're now well into our second century. The commitment to caring lives on. The Royal Columbian and Eagle Ridge Hospitals. Together, we're growing and planning ahead. And with your help, we'll confront the challenges of a new age. We're proud of our past and part of your future.